Well, welcome to Ask an MS Expert Veterans Program. My name is Emily Riley, and I'm the moderator for this wonderful program. I am a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I have been living with MS for over 17 years. I am currently located at Scott Air Force Base. Thank you so much for joining us. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. MS navigators are online throughout the program, answering questions and providing resources. So please post any questions or comments that you may have in the comments box here on YouTube. I'd like to acknowledge and thank today's sponsor, Lockheed Martin. Support from MS community partners helps the National MS Society reach our goal of providing up-to-date information and support through programs like Ask an MS Expert Veterans Program. Navigating all the benefits and services available to veterans can be really confusing, but the Department of Veterans Affairs, Paralyzed Veterans of America, and the National MS Society can help. Today, we are talking to Bethany Ferguson and Marco Rossi about veterans benefits, services, and how veterans can access them, and how the Department of Veterans Affairs, Paralyzed Veterans of America, and the National MS Society work together. Bethany Ferguson is a social worker and the Spinal Cord Injury Coordinator at the MS Centers of Excellence East, Department of Veterans Affairs. Marco Rossi is an Associate Director of Field Services at Paralyzed Veterans of America. I would like to welcome Bethany and Marco. Thank you so much for being here today. All right, so the VA offers a variety of medical support, benefits, and services for veterans, with many of them being particular interests for veterans with MS. First, let's talk about the Veterans Affairs Multiple Sclerosis Centers of Excellence. So Bethany, what's the purpose of the centers and what do they provide someone living with MS?
Sure. And again, thank you for having me. So Centers of Excellence are dedicated to understanding the impact that MS has on veterans. So these centers are focusing on research, education, outreach, and training for providers that are serving veterans with MS, but also focusing on outreach and support for veterans as well.
Great. And how many centers are there across the country, and are veterans able to access services like no matter where they live?
That's a really good question. So there's two coordinating centers. There's the East Coast, which is the Baltimore VA, and Baltimore, Maryland, which is my space. And then across the country in the West, there's Portland, Oregon, and Seattle, Washington, which share a coordinating center. And then there's multiple support programs and regional programs throughout the country. So veterans all over the country have access to either a coordinating center, like where I'm at, or across the country in the West Coast, or support centers or regional programs throughout the country.
Great. Now, for over 75 years, Paralyzed Veterans of America, also known as the PVA, has been a support system for our nation's paralyzed and disabled veterans. So, Marco, can you tell us about the PVA and its mission?
Hey, thank you, Emily. And yeah, PVA was founded in 1946. I was right at the tail end of World War II. And essentially, that was the first time, in a war that there were service members that were surviving combat spinal cord injuries and returning home and essentially needing care and needing benefits. And so a number of veterans with spinal cord injuries banded together and were sort of the fledgling initial foundings of PVA. And about 25 years later, in 1971, PVA received its charter from the United States Congress, which, like our brother and sister veteran service organizations, essentially gives PVA the authority of Congress to advocate for veterans and survivors and dependents before the United States Department of Veterans Affairs.
Okay. So in addition to like spinal cord injury and disease, the PVA is also focused on helping veterans who live with MS, right? So what is the PVA specifically doing for veterans living with MS?
So beyond what we do and target for veterans with multiple sclerosis, we advocate globally for all individuals with multiple sclerosis. And that has to do with improvements in federal law that affect, again, people with disability in general. I mean, again, as you can expect, our advocacy efforts really target on U.S. military service members and veterans. PVA also has two magazines under regular publication, PN and Sports and Spokes. PVA is also a partner in the annual National Veterans Wheelchair Games that this year is held in Portland, Oregon. And in addition, PVA provides its annual summit, which is a healthcare training that focuses specifically on spinal cord injuries and disease with focus areas in multiple sclerosis.
Great. Okay, so let's talk about how veterans with MS qualify for some of these services that you all have both mentioned. Some services and benefits are based on level of severity of disability, while others may be based on service connection. So, Marco, can you explain what the term service connected means and why it's so important?
Yes, I mean, being a great many things really hinge on that determination that the Veterans Benefits Administration makes. And that's something that we just generically refer to as service connection. So what does service connection mean? Essentially, the VA, and when we say the VA, we're talking about the Veterans Benefits Administration here versus the Veterans Healthcare Administration, which which the VA provides in its hospitals and clinics. So with the Veterans Benefits Administration, that determination of service connection is a legal decision that says that the VA presumes that there is an association of your diagnosis as a military veteran and your diagnosis of MS. So your service-connected disability is presumed to be connected. Becoming service-connected for MS is something that many in the military and veteran community will easily understand. But the specific legal criteria for multiple sclerosis is quite unique. And navigating through the claims process is something that I suggest every veteran with MS seriously consider. That also can be impacted by the nature and level and degree of severity of disability as well. So the main thing is, again, as a segue, is really important and suggests that any veteran out there, or again, caregiver, spouse, or loved one, connect with one of our PVA field service offices to discuss their situation in greater depth.
I think that's a great point because everyone's situation is just so unique. So the next two questions are kind of for both of you. So Bethany, I'll start with you. What additional services are available to veterans living with MS, whether their MS is service connected or not?
Yeah, that's, again, a really great point. So, a veteran who's service connected or not still has access to primary care and specialized care within the VA healthcare system. So, accessing a primary care team that's complete, an interdisciplinary team that's complete with obviously a doctor, a nurse, a social worker, a pharmacist who's following their normal general care needs, on top of any other specialized care they might need for anything that's not related to their MS. Also, there's access to other programs such as our psychosocial groups, our whole health programs. There is peer-to-peer counseling and support. There's a lot of other programs outside of even our specialized MS care that we provide to veterans, despite their service connection or what they're service connected for.
Great. So Marco, do you have anything else to add about additional services?
Yeah, as far as the Veterans Benefits Administration goes, for a veteran that is adjudicated as being non-service connected for MS, there is also the possibility that they could be eligible for a VA non-service connected pension. There are requirements for that as well. The first is that the veteran has to have at least a day of wartime service, and then their particular lengths of service vary depending on when they served in the military. In addition, the pension program is an income and net worth based benefit. And again, because that can obviously varies from person to person, that's a discussion that we would want you to have with, again, a local PVA service office.
Great. So it sounds like there's a lot of really great benefits and services available. So what is the next step for someone to access these? Bethany, if you want to share first.
Sure. So the first step would be to getting connected with your local VA. So that could be starting with either walking in and going to the enrollment services office, or if you prefer to do it online, you can apply for services online or call. There's a 1-800 number that you can call as well. So you'll speak with a representative in enrollment to help you get enrolled in the VA healthcare system. The next step would be to set an appointment with a primary care team so that you can get established. And once you get established and start meeting with your primary care team, they'll make appropriate referrals to the MS programs or other specialized programs or support programs that you might benefit from.
Marco, do you have anything else to add?
Yeah, I would also, beyond what Bethany provided and described, In terms of, again, the veterans benefits side, and if you happen to contact us first, what we would do is we would ask you, have you used VA healthcare in the past, or are you currently actively receiving healthcare? If not, we will make referrals over to our VA Spinal Cord Injury Coordinator. I'd also suggest a direct way to connect with a PVA field service office is to go to pva.org, click on Veteran Services, and further on the Find a National Service Officer button. And you'll put in your demographic information, address, zip code, and you'll populate for you who the service office is, or what service office is near you. And in addition to that, if you just need help just connecting in general or whatever, just feel free to call our Veterans Benefits Department directly at 866-734-0857. And again, that will serve to connect you to ultimately connect you back to one of our PVA field service offices.
Great. We'll be making sure to share these resources in the chat below for you all to reference. All right, so we heard from Robin, and she's wondering if the VA has services to support caregivers of veterans with MS. So Bethany, can you tell us a little bit about the VA Caregiver Support Program?
Sure. Yeah, our caregivers are they're crucial to the way that our veterans are able to not only live with MS, but be able to thrive and function. So we really want to make sure that we're giving the appropriate attention and resources to them, which is why the Caregiver Support Program was developed by the VA. We're really excited about this program. There's actually two separate programs within one. So there's a comprehensive program, which is allowing different resources such as support groups, clinical services, training that's specialized depending on what that caregiver might be providing care for to that family member or veteran that they're working with. There's a stipend that's available as well, and you have to meet certain eligibility requirements to be able to access that stipend. There's a secondary program, which is a general program, which has more general eligibility requirements. And that program helps veterans caregivers access peer-to-peer support groups, one-on-one training, and there's also coaching support as well. So really providing two different options for our caregivers to be able to access supports and to allow them to work with other caregivers and other trainers who can help them to support our veterans with MS and also help them to be able to keep veterans with MS at home and in the environments that they want to stay in.
That's really amazing to know that, not only are the service members being taken care of, but caregivers too. And
yes,
that shared experience with other families probably is so empowering for them. So I'm happy to hear it's available. So how could someone apply for these caregiver services and resources and learn more about them?
Sure. So there's, again, a few options to apply. The fastest way would probably be to apply online. There's an online application that's available on the www.va.gov/caregiver support link. And I know you guys said that you'll share those links. So that's probably the quickest way to apply is just doing it online. You can also use a caregiver support locator tool that's on that website to be able to find the local caregiver support program office near you. That way you can contact them directly and speak to them about the veteran specific needs and clinical needs, caregiving needs to figure out if that veteran might be eligible and what that process would look like.
Okay. So kind of going along the lines of the importance of connecting with others, MS can be such an isolating disease. And so staying social and engaging in support groups is really important for someone living with MS. So Nicole asked if there were any support groups and social opportunities for veterans with MS within the VA. So Bethany, can you share what kind of opportunities are available for them?
Yeah, there's so many opportunities, which is so exciting. I actually just hosted one last week, which was a virtual support group for veterans. So we do a lot of support groups. It's really going to be unique to the local VA, but the great thing about a lot of the support groups that we're doing, as I just said, is I just did a virtual one. So even if your local VA doesn't have a in-person support group there at the VA, you might be able to access community support groups that are virtual or in person through wonderful organizations like the MS Society, which I know shares those supports as well. Or again, talking to your primary care team at your local VA so they can connect you with the local mental health groups and specialized support groups that might be available and running at your specific VA.
So great. Sounds like there are lots of opportunities for people to connect.
Yes.
All right. So let's talk about the VA's prosthetic and sensory aids services. So Bethany, what kind of access equipment and services does this service provide?
Sure. So it's a very vast range of services are provided. So pretty much, what our veterans might need to help them live comfortably and safely and function despite whatever their physical or mental or medical limitations are. So that could be hearing aids, other sensory aids. It could be things like a shower chair or, handrails to be installed in your home. So those could be those very concrete needs that the prosthetics department can offer. And there's also a non-service connected HISA grant that's available. And that grant is a grant that's provided to veterans to help them make modifications within their home to be able to allow them to be able to safely access their home inside and out, depending on what their needs are. Again, there's specific eligibility requirements and application processes for a lot of these requests through the prosthetics offices. A lot of this equipment has to be requested through the provider, but it's really great to start with your primary care team again, and then have them connect you with the prosthetics office or make those necessary orders.
Great. So Marco, what can you tell us about the Automobile Adaptive Equipment Program, Clothing Allowance, and Home Improvements and Structural Alterations programs? Lots of things. So start with Automobile Adaptive Equipment Program.
Yeah, so Emily, there's essentially two main programs, and like many others, they are divided by those with service-connected disability and those with non-service connected disability. So to those with service-connected disability, and let's say a veteran that is service-connected for multiple sclerosis, the VA would have also have to adjudicated or made a legal decision that they have essentially what we would call loss of use of at least one extremity to be eligible for what is called the automobile grant through the Veterans Benefits Administration. And that approval of the automobile grant and authorized VA Form 21-4502 then essentially becomes kind of the ticket to speak to the prosthetic service. Like Bethany had just noted, the best way to navigate through the process, though, is talk to your primary care provider, and ask them for a consult to prosthetics specifically for automobile adaptive equipment. And with the VA, that authorized VA Form 21-4502, the veteran with service-connected multiple sclerosis can then go through a process and then be administered and approved for automobile adaptive equipment. So wheelchair lifts, easy lock brackets, hand controls, and air conditioning, and a number of other types of equipment that are adaptive in nature. Again, those are administered for automobile adaptive equipment through the prosthetics department for those with service-connected disability. With those with non-service connected disability, there actually is also a program that is administered. And the one of the chief differences between those two programs is that those with non-service connected multiple sclerosis have to be determined by their VA care team to require an adaptive vehicle to actively participate in their VA healthcare. And so again, it goes through a similar process of primary care provider consult to prosthetics for automobile adaptive equipment. And then there's essentially a workup and a process that's gone through to determine, again, whether it be a wheelchair lift, easy lock brackets or tie downs. And again, one of the last really distinguishing differences between those two programs is those with non-service connected MS cannot be provided operational equipment. So the VA will not, through prosthetics, provide hand controls or again other equipment to operate the vehicle.
Let's see. Wow, I'm sure that provides a lot of independence for people if they're able to access this service.
Yeah, absolutely. And as far as the clothing allowance goes, that program is strictly a service-connected program. So veterans that have service-connected multiple sclerosis and require different types of adaptive equipment, that's generally what we would see as adaptive equipment, wheelchairs that otherwise wear out the clothing more rapidly than it would have otherwise. Then the VA provides an annual clothing allowance to provide essentially a payment for clothing.
Wow. And then what can you tell us about the home improvement and structural alterations program?
So that is now has an actual provision for both those with non-service connected disability and service connected disability. For those with non-service connected disability or service connected, it starts off the same, like Bethany had mentioned earlier. Talk to your primary care provider. They'll put in a consult to prosthetics for HISA. Again, those with, and this is where this gets a little bit different. But for veterans that have no non-service connected conditions or their service connected conditions combined to 40% or lower, or again, are non-service connected for MS in this case, they would be eligible for HISA provided that they require a structural alteration to their home environment in order for them to essentially continue to independently or just to be able to successfully live within their home. Now, this is where it gets a little bit more tricky, is that for the service-connected HISA grant, you can actually have non-service connected multiple sclerosis, provided that you have other service-connected disabilities that combine to 50% or greater. You are still eligible for the service-connected HISA grant, even if the reason you need it is because of disability caused by non-service connected MS. And then for every other veteran that has service-connected disability at 50% or greater, or for those that have service-connected MS, they are, as you can imagine, they are eligible for the service-connected HISA grant.
Great. All right, so we're going to switch gears a little bit and talk about the PVA. So Marco, the PVA has National Service Officers, also known as NSOs. You've mentioned these a few times, that will help veterans, dependents, and survivors. So can you explain to us what a National Service Officer does and how someone can contact one?
You bet. Thanks, Emily. So PVA service offices are operated by trained advocates and administrative support personnel who specialize, again, in providing our direct advocacy and representation before the Department of Veterans Affairs. And National Service Officers are our main touch point to that. The way to connect to them, the easiest ways are going to be go to www.pva.org and click on the PVA service office button, for find a PVA National Service Office, and click on that button. Again, put in your demographic information, and that will populate the office nearest you and provide you their contact information. If all else fails, though, you can call our Veterans Benefits Department directly at 866-734-0857, and we will help to make that connection.
Great. Now, we heard from Gianna, who's a veteran with MS, and she's wondering if the PVA can assist her with filing a claim for service-connected compensation administered by the Department of Veterans Affairs. So what type of information would she need to file a claim?
Emily, this is a perfect dovetailing into what we would suggest what to do before you contact the PVA service office. There definitely is some preemptive or sort of preparatory work that you can do that will make that first visit with our service officer more effective. What are those things? So the first thing is get a copy of your DD Form 214, which is a certificate of release of discharge from military service. So have that on hand. That's number one. Number two is service connection for multiple sclerosis is legally based upon what's called a presumption. And that presumption allows for essentially symptoms of MS needing to present on active duty and or going through 7 years of release from active duty. So for instance, if a veteran served on active duty from 1984 to 1988, then for the purposes of presumptive service connection for MS, the clock essentially for symptoms would start in 1984 when they entered active duty. And then from when they were released in 1988, it would go until that same period ending in 1995. So that period of presumption that would allow for there needing to be a presentation of initial symptoms. And so those things that might have easily presented, and many times do, as kind of like little nuisances or kind of like, and sometimes not, sometimes much more severe, but sometimes just those things that initially maybe you just complained about to your primary care doctor, and they just sort of, wrote it off as, you're getting older, or, maybe you were just tired that day or something, right? And so that particular period of time and locating and obtaining those private medical records is absolutely critical to the conversation and what we will look for in terms of developing the process of filing a claim before the Department of Veterans Affairs for potentially service-connected disability. So that part of the preparation process before calling our service officer is absolutely critical. The other thing to do is to start putting together your own testimony if you've never done it. And that's just essentially writing out in a narrative form how you saw how MS presented in your case, and documenting that, being specific to time, place, and person. Where were you at that time? What time was it, in the veteran that went into the service in 1984 and got out in 1988? Maybe their symptoms didn't present until 1990, but maybe they didn't go to a doctor initially because they were working and trying to live life, and they just weren't going to go to the doctor because their vision was a little bit blurry, or because they noticed that their leg was a little bit weak and they were kind of stumbling, and their friends were asking them questions like, what's going on? And they're like, hey, listen, I'm all right, and maybe they didn't go to the doctor, right? So documenting those symptoms, though, in their own narrative can also be really important to that ultimate process of filing a claim for service-connected disability. So in summary, those three things: DD Form 214, going out and getting all private treatment records for any care that could be connected to early and presenting symptoms of MS, and then also putting together one's own comments and, again, their sort of history of how they see the MS presented in their case. Those would be the three main things to be prepared for before calling one of our offices. And again, the biggest help for us in terms of, again, filing a claim for disability.
Those are so helpful. Thanks for laying those out. So short and concise. That's super helpful. So both you and Bethany have kind of mentioned benefits and grants. And so there's a lot of benefits and grants available through the Veteran Benefits Administration. And these are for veterans who meet certain service-connected disability and eligibility requirements. So Marco, can you tell us about some of the benefits available through the Veterans Benefits Administration?
Again, another great question, Emily. And so for veterans that have been adjudicated or been, decided service connected, there is a basic level or a minimum level of disability that is, what comes with that is a monetary monthly payment. When a veteran with MS reaches a certain level of disability, as many do, unfortunately, where they may become functionally paralyzed in an extremity. So for instance, as we talked about earlier, in the prosthetics department over in the hospital, the automobile adaptive equipment program, one of the predicators or requirements for automobile adaptive equipment for those with service-connected disability is what is called a grant of the automobile grant that the Veterans Benefits Administration oversees. That grant requires that a veteran have functional loss of use of at least one extremity. And when that determination by the Benefits Administration is made, then entitlement to the automobile grant is warranted. And that is, again, what jettisons, again, that automobile adaptive equipment program component that we spoke to earlier. There's also the specially adapted housing grant. And that is a grant that's, again, for only those that are adjudicated service connected for multiple sclerosis. And that is a payment that is made to assist with, and it's not just a payment, it's a program with a pretty involved process, but one that essentially assists eligible service-connected veterans with modifying their home to be able to essentially make it more accessible, more livable. And so that's the specially adapted housing program. It requires, generally speaking, a loss of use or essentially functional paralysis in two extremities. There are other instances where that can be granted, but that's sort of the minimum general requirement that we would see. But again, with any of these, definitely recommend a conversation to a PVA service office to talk about your case specifically. There's also VA administers a VA life insurance program. There's also vocational readiness and employment that is provided to any service connected with MS to be able to be essentially worked up and assessed for eligibility for that program, which can help with overcoming disability to be able to continue to be meaningfully, substantially, gainfully employed. There's also a program for those benefits inside the Benefits Administration for Service-Connected Disability, where if that individual's MS progresses to the point where they require the assistance of another person to manage their activities of daily living, like if the vet needs help with bathing, feeding, dressing, and these types of things, there's also benefit referred to kind of generically, we call it aid in attendance. And that benefit is also available for veterans in those particular cases. I can tell you that it's this upper level of benefits is quite complex. The matrix for achieving or those types of entitlements are, again, something I can't understate or can't state enough how important it is to have a skilled advocate by your side guiding you through that. But I think that's provides kind of an overview of some of those basic benefits administered for, again, the veterans with service-connected MS.
Great. Yeah, thanks for sharing. So we heard from Paul, and he's asking if the requirements for service connection are not met, is there other financial assistance available through the VA? What would you tell Paul, Marco?
Yeah, so Emily, there is a program referred to just sort of generally as the VA's non-service connected pension program, and also what is called the special monthly pension administration that has to do with when veterans are factually homebound, or if they require the regular assistance of another person to manage their activities of daily living, then there can be again what's called special monthly pension with what we call with aid and attendance. So regardless, though, the pension program for those with non-service connected disability is a program that requires a minimum amount of service to include wartime service. And also, it's a program that is based upon income and net worth. So again, as a part of our just standard workup with every veteran with that we advocate for, when a vet with MS calls us and we work through that process of determining whether or not a claim for service-connected disability is warranted or perhaps not. This is the conversation around that pension program is a part of our general workup. And again, reaching out to that local PVA service office is the first step to do that.
Great. All right, so let's talk about PVA membership and what that means. So how do you become a member, and do you have to be one to receive PVA services and program opportunities?
That's a fantastic question. And I can tell you, Emily, that there's one of the greatest maybe spots of confusion that people have. And I can speak for myself as a veteran was, what does it mean to be represented by a veteran service organization versus what does it mean to be a member of that organization? And so so a veteran could be a member of multiple veteran service organizations, depending on their service and meeting the criteria of that particular organization. But membership with that organization is not the same as representation. And representation or advocacy, as we've kind of used that term through today's program, has to do with establishing and giving permission to a veteran service organization to assist them with their claims for benefits before the Department of Veterans Affairs. You can only be represented by one organization at any given time. And so membership for PVA, if you're a veteran with MS, you're eligible for, if you have honorable service and you're a citizen of the United States and you have a diagnosis of MS, you're eligible for membership. What I would suggest to those folks is to go to pva.org, click on the membership button, you'll see it on the top, and then just click on the little button for apply for membership, and there's a relatively simple online process. There is no cost with PVA membership. In addition, that's something to let you folks know as well. Yeah, and lastly, there is no requirement to be a PVA member to be advocated for by PVA. Of course, we're big fans of our local chapters, and we definitely like to see every veteran with MS plugged in. And they're great, essentially local bodies of actual veterans with spinal cord injuries and diseases like MS that do awesome work, local work, advocating and assisting each other. But no, you do not need to be a member of PVA in order to, contact PVA and to receive our assistance before the Department of Veterans Affairs.
Great. Well, that's good to know. So you kind of touched on this a little bit ago, but you'd mentioned that the VA has like a career program, Veterans Career Program, which helps veterans reach their career goals. So can you tell us a little bit about this program and the what kind of services that they offer?
Yeah, Ellie, thanks. Good question. And yes, so the great part about PVA's career program is that if you're a vet with MS and you're just wondering, and you're thinking like, maybe you're already service connected, or maybe you're recently out of the military and recently diagnosed, or whatever your situation may be, it's not uncommon that you might be thinking about, heavens, maybe you're separated from the military and you're like, well, I don't know. Am I going to be able to get back to work? And is that going to be something I can do? And so I would say probably one of the most, excellent, benefits that comes from our career program, voc rehab counselors, is that you can talk to them. And again, these are experts in, helping individuals to overcome disability and become, gainfully, meaningfully employed. And with our career program, they look at the absolute smallest to the biggest picture and will help you as an individual to, in a completely unbiased way. They're not out there trying to motivate you or steer you in one particular direction or another. They're totally, looking to put themselves into your shoes and say, what's in the best interest of this individual? And, what is it that I can do to help them navigate through to get to that goal? And so that is the biggest thing, is helping to look at things. So you might be eligible for VA's vocational readiness and employment program, but you're not really sure because maybe that counselor said, well, we're going to help you go through and get this 4-year degree, undergraduate degree towards this employment goal. And that's it. And you kind of feel like, well, geez, I'm not absolutely sure that's what I want to do. Can I talk about that a little bit more, or maybe look at something else? And so, again, our career program folks will be able to, again, step outside of that box and be able to just speak to you more, kind of like a brother or sister, and be able to say, but the greatest part is they have the benefit of being a professional voc rehab counselor too, and so they'll be able to come alongside you and look at your situation and again, guide you in ways that maybe you haven't thought of. Maybe volunteering might be a good path towards maybe a career ultimately. Or maybe you've tried a career that didn't work, and maybe volunteering might be a better long-term goal, and again, just the point being with this is that there's a lot of different things that get looked at that you are generally not going to probably get in a conventional voc rehab program. Probably the greatest thing about our career program, by and large, strongly suggest it. Again, if you want to know how to connect, ask your PVA National. It's a recurring theme here. Ask your PVA National Service Office and they will connect you. They'll talk to our voc rehab folks, our career program folks, and they will give you a call.
So great. I think it's so important to, everyone wants that sense of purpose. And so the fact that you all are kind of helping them, guide them and finding that, it's really important. Well, I really thank you so much for sharing such valuable information for our veterans. I'm just so encouraged learning about all these amazing resources that are available. We're going to kind of talk a little bit about how the VA, the PVA, and the National MS Society work together. So the Department of Veterans Affairs, MS Centers of Excellence, Paralyzed Veterans of America, and the National MS Society, they all work together to improve the care and expand resources for veterans living with multiple sclerosis and their families. So Bethany, can you tell us how all three of these organizations collaborate with one another?
Sure. Yes. Our collaboration is key, and it's amazing that we can collaborate to provide these great programs for veterans. So I'm so glad that we get to talk about this. So the VA and the MS Society formalized a partnership in 2019 that allows us to work with the National MS Society and do a lot of great things. So some of those things are MS or the MS National Society's MS Navigator program. So how this program relates to the VA is once we submit a referral, so they then review that referral and make sure that the veteran's being connected with community programs they may not have known about. And maybe myself as a social worker working in Baltimore doesn't know about programs that are available, just 60 miles down the road. So it's really great to be able to use the MS Navigator program for that. And again, I want to stress that there's a national curriculum that was developed for the for the MS Navigators to be able to learn how to serve veterans as they receive those referrals. There's also our current topics program, which the VA MS Centers of Excellence collaborated with the National MS Society to develop a CME and a CE series for providers such as physicians, again, pharmacists, social workers, other mental health counselors, and other VA professionals that are working with MS, patients that have MS. So these programs are available to help us get the most up-to-date research on MS and how we can best care for our veterans. And then we have a lot of resources for veterans. And one program that the MS Society developed was a great handout that has a lot of different resources and gives a lot of one place for caregivers and providers and veterans, of course, to go to find all the different resources available. And then lastly, the PVA Healthcare Summit and Expo is something that the MS Society and the VA all come to and contribute to through educational offerings and other things, presentations, other things like that. So there's a lot of great ways that we all work together to try to make sure that we're providing up-to-date education and information to our veterans and making sure that we're also, collaborating and we're not giving repetitive information, and we're able to kind of have a seamless, line of communication as we talk to one veteran who's coming through the door looking for help.
Yeah, it almost sounds like if someone reaches out to PVA, then they'll connect to the National MS Society and the VA or
exactly.
Really all are working in a coordinated effort. And I think that that's so important. So I'm happy to hear that.
Yeah, and just to jump on that really quick too, I want to jump into what Marco was saying. I just think about myself and the clinic that I work in. We work so closely with our PVA rep, and really, like some of the things that Marco was saying, I'm sitting here taking notes, thinking these are things that I need to tell some of my vets about a testimony that they should write, and things like that to be prepared for. So I think it's just so great that we have these opportunities to engage to help our vets with MS.
Absolutely. I mean, knowledge is power, right?
Yes.
So I love that. So Marcos, the National MS Society has several resources to help veterans living with MS. Can you tell us about some of these resources?
Yeah. So just piggybacking off of, what Bethany was talking about as far as the MS Navigator, what that program does to essentially help to connect, individuals with MS and, including veterans, but for all folks that are living with multiple sclerosis, is the ability to have questions and to be able to connect to a resource that can help get answers or connect them to resources where they can get those answers. And being able to have that resource available to us as advocates, before the Department of Veterans Affairs is obviously, veterans' lives don't just work inside the bubble of the VA. People live in communities. And so, they need to access things like looking for whatever it is. It might be an accessible apartment or, you name it, or maybe looking for a parks program that does, maybe a hand cycling program or whatever it may be. And so being able to connect to an MS Navigator and maybe the rep therapist through Bethany, at a VA medical center, and being able to connect those dots, because what you guys just said at the very end there was so key. It's about linking and connecting each other to resources so that we can live more full and more independent and just more enriched lives. And so the MS Navigators are just awesome for that. Being able to connect to them by phone, email, or through the MS Society's website chat. this particular program, the Ask the an MS Expert program that the National MS Society puts on 4 times a year. These programs are then stored in the society's website and on their YouTube channel, so you can go back and tell a friend about it if you found something good about this program that you were able to plug in and see today. Great part is you might have a friend and maybe they were at work today, but that they needed some help with something, and so direct them to the channel. They can pick it up after the fact. Also connections through programs and self-help groups, the National MS Society community on Facebook. To find a group just for veterans and active duty military, or to learn more about how they can get involved, they can go to the MS Society's website at nationalmssociety.org/connections programs.
Wonderful. Thanks for sharing all those resources. So Bethany, Marco, thank you so much for sharing such valuable information today. So I want to ask you both to kind of share your top 3 takeaways that our audience can really begin to act on now. So Bethany, how about you start us off? What are your top 3 takeaways?
Sure. Yeah, I love rounding it out that way. I feel like we covered so much great info today. So so the first one I can think of, and this is for any veteran, is even if you do not plan to use the VA, or even if you only plan to use the VA for primary care once a year or for some other specific program, the first step is to get established and to get enrolled in your VA healthcare. So that, even again, if you plan to stay with your doctor that you've been with for years, or you really are not sure, I still recommend getting enrolled. So the easiest way to do that, as we said earlier, is to, there is a 1-800 number. The number is 1-877-222-8387, or you can go to www.va.gov. /apply and follow the prompts to apply for healthcare right there. And also www.caregiver.va.gov is a great resource again for applying for the caregiver resources. But I would say getting enrolled into VA healthcare, even if you're unsure of what you plan to do with it, or if you even plan to establish care with the MS programs, would be my first recommendation or takeaway. And then again, as Marco and I have both kind of, said repeatedly throughout this program, is every veteran's situation and eligibility is going to look different for some of these programs. So just because one veteran has been eligible for something doesn't mean that the next veteran is going to be. It depends on their clinical diagnoses and their history and their dates that they've served and a lot of other criteria. So just we want to really recommend that you take advantage of the PVA reps and of the social workers and other people that you have available to you within the VA and with these other great organizations to help you have a very tailored experience in figuring out what you're eligible for. And then last is the VA is a very, very large system. As you can tell, there's so many programs. So, getting established and speaking with a social worker, or again, your primary care team, just to have somebody help you to navigate is well worth it. Again, even if you're not sure what you want to do or how you want to utilize your VA benefits, it's still worth it to keep in mind that it's large. So you just want to get established and then find a point of contact like a social worker to help connect you.
I love that. Thanks for sharing those things.
Thank you.
What about you, Marco? What are your top 3 takeaways?
Yeah, well, first, Bethany and Emily, thank you so much for this opportunity today. And I would make my top 3 list actually my top 6, because I'm going to take Bethany's and say those are, because if you don't have healthcare, then a lot of these things that I'm going to say in my list, it's just healthcare is so doggone important. We all know it, right? But what Bethany said is so critical. And so I'm going to just say, I'm going to take those 3 and I'm going to go number 4 here. Now we're going to go to claims and say, get your paperwork together, get your paperwork and your evidence together, your DD-214 and your private medical evidence. You go out and, regardless of what you've done with this in the past, I can't begin to again state how critical that is. So do that work and get everything that's out there. The second part is go to pva.org and again, click on the button to, for veterans benefits and to find a national service office and get the phone number for that PVA service office and give them a call. And again, if you're at all needing assistance or just you're having a problem making that connection, give us a call at 866-734-0857, and we will work to get you connected.
Wonderful. Well, Bethany, Marco, thank you so much for being with us today and sharing such valuable information for our veterans living with MS so that they can continue living well with MS with all the support that you provide. I want to remind everyone that you can connect with an MS navigator via phone, email, and through the Society's website via chat. For information and resources on MS, visit the Society's website. You'll find research updates and news, self-help groups just for veterans and active duty military, more ways to get involved, and upcoming events near you. You can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitter, YouTube, and LinkedIn. So I encourage you to like and subscribe and get on the Society's mailing list to continue to receive up-to-date information on MS and updates and upcoming programs. I want to thank Bethany Ferguson and Marco Rossi for sharing your knowledge and for everyone's engagement in today's program. The recordings will be available on the Society's website at www.nationalmssociety.org/MS expert. I invite you to join us in September for our Ask an MS Expert Veterans Program. Lastly, it's important to get your feedback on today's program. You'll see a little survey in the comment section on YouTube. Completing this survey makes a difference, and it only takes 1 minute. So complete that survey. The information you provide us helps to continually improve and shape future segments. So thanks for joining us, and we'll see you soon.